So, hi guys, how is everybody?
Great.
Good.
Okay.
So, everybody here is with CERCL, which is a initiative that was created by Loyola and some other community organizations at the beginning of the pandemic earlier this year. You guys did a tremendous job making sure that residents in Proviso Township, particularly Maywood and Merrill's Park, were able to receive free COVID-19 tests, particularly when they were scarce and when they were hard to get. So, you know, people may not necessarily be familiar with everybody who's on the screen, but you are basically the people who make CERCL work. And so obviously CERCL was one of the people of the year that Village Free Press selected in 2020, largely because of the work that you all have done, making sure that people get tests for COVID-19. We'll also be talking about the vaccination and how people can possibly sign up, some things that they may expect with the vaccine, along with some other stuff. But without any further ado, I just want to allow each of you to introduce yourself, explain what CERCL is. I think Amy, Luke, we could start with you to talk about where CERCL came from, how it originated, and what it's been doing since March.
Okay, great. Do you want us to introduce ourselves all together or just right now?
Yeah, Amy, if you can introduce yourself, talk a bit about the origins of CERCL, and then we can just go around the room, I guess. In alphabetical order? I don't know.
I'd be happy to, Michael. Thank you so much. First of all, thank you to you and to the Village Free Press for selecting us as one of the people of 2020. So my name is Amy Luke. I am a professor of public health sciences at Loyola here in Maywood on the health sciences campus. And I'm also a Maywood resident. I live on the north side of town. So to talk a little bit about, the origins of the COVID Equity Response Collaborative Loyola, otherwise known as CERCL, I think if we go back a year and we were watching in public health and in medicine, and I know my colleagues will talk about that as well as community members, we were watching what was happening around the world with COVID-19 and the coronavirus. And then Illinois went into lockdown. And those of us in public health were very frustrated. And we weren't able to do much to affect this issue. We all felt helpless, basically. And so we have a lot of feedback. I don't know.
Yeah, I was going to say, do you all hear that reverb?
Yeah.
Does somebody have Facebook open? No. Let's see. Hold on a second. Still here, right?
Yeah.
Sue should not be in here, but
Oh, okay. Sorry. Let's what it is.
it's up for a second.
Yeah, and then it's oh, okay. Maybe if you all could mute yourself.
Oh, that sounds great.
Okay, yeah.
Okay.
Okay, that was Camille. See what happens when she's not on the.
We love Camille.
Thanks, Camille. Okay, you can continue. I guess we'll try to edit that out of the action.
Okay, well, all right. So I'm Amy Luke. I'm a professor of public health sciences at the Parkinson School of Health Sciences and Public Health here in Maywood. And I'm also a Maywood resident. I live on the north side. And I think all of us were watching what was going on in the world and getting very frustrated knowing there didn't appear to be a lot we could do hands-on. And for those of us who are in public health, and I know medicine was dealing with their own issues that'll be talked about, it was an incredibly frustrating time, especially when we went into lockdown. And we were watching what was going on in the world and in our neighborhoods. We knew that the neighborhoods with predominantly Black and brown populations were being extremely hard hit by this disease. And yet it didn't seem like there was a lot going on. And nor was there a lot that we felt we could jump into at that point. I think we were kind of looking for the rudder, something to show us the way. And this is very personal, but one of my best friends died on April 10th in Ghana from COVID. And it was an incredibly emotional time. And then the very next Monday, it's seared in my brain, on April 13th, I got a telephone call from Trustee Nathaniel Booker, who had just been meeting with State Senator, Majority Leader Kim Lightford. And they were wondering, did Loyola have plans to test in the community? Did Loyola have connections with an FQHC to address this issue of federally qualified health center? Mm-hmm. So I know that Doctors Blair and Stranges can talk more about FQHCs if that comes up, but we don't. Loyola does not sponsor a federally qualified health center. And just so we're very, very clear, the health system and the university at Loyola are separate entities. And so as a university employee, I could be very upset about what the health system was or was not appearing to do in the community. But I have no say in the health system. But what was clear is that we weren't offering community testing. And we, being the university and the health system, also wasn't. And yet early on, the Cook County Department of Public Health data showed that Bellwood actually was the very first community to sort of shoot out at the top of the leaderboard, if you will, for suburban Cook County. Maywood was close behind, and then Melrose, Berwyn, and Cicero, these 5 communities that are predominantly African American and Latinx, were carrying an outsized burden. And I will tell you that they are to this day. So it was really that phone call from Trustee Booker, sort of poking around, seeing what Loyola was doing, that really spurred us to pull in. Dr. Blair and Dr. Stranges were working with medical students at that time with a call center and providing food for frontline healthcare workers and babysitting for healthcare workers. And it really was at that point that we mobilized as a group. We pulled in our community-based organization colleagues. We pulled in medical students, nursing students, public health students, and staff and faculty. Mm-hmm. And that eventually spread to our law school and our School of Social Work as well. And then we reached out through a variety of community organizations, CSPL, which is the Coalition for Spiritual Public Leadership. Yeah. Exactly. And they actually were the ones who got Gwen involved with us. And so we were able to secure some funding and to pay for testing, because that was the other thing. This testing is very expensive. And so we got some internal funding from the university to pay for testing, and we started in July. And a lot of that was down to the community connections and the community work that our partners did, including Miss Gwen, who'll talk. So I'm gonna stop.
So you said that resulted in the group of people that we see here. So if each of you want to kind of introduce yourselves individually and kind of explain what your role in CERCL has been for the last several months.
Do you want me to go next?
Yeah, just whoever. Yeah, just kind of.
I think I am alphabetical last name.
Okay.
I'm Amy Blair. I'm a family physician in Maywood. My clinic is on Roosevelt Road, and I am affiliated with the health system and also the medical school or the university at the same time. So I also remember Amy Luke's call very well to me saying, you know, we may have this opportunity to do some testing through the tests that we were able to get through Trustee Booker and State Senator Lightford. So it was really about executing testing in a time where it was just immensely difficult. And I think as a physician, I was all day with my patients, many from Maywood and Bellwood, with COVID symptoms, but not being able to get them a test, which was just heartbreaking. Mm-hmm. So it really kind of launched us forward. And as Amy said, we got a lot of students involved because medical students at that time, weren't able to be in the clinics. It wasn't safe for them. And they were then able to kind of get on the phones and help us really form coalitions and organize how we were going to pull off free testing in the community, which was exactly what was needed at that time. And so as things went forward, I think we mentioned CSPL, coalitions were made with Ms. Gwen and the Rock of Ages and the Casa Esperanza and Melrose Park as testing sites. Because from the medical standpoint, we knew that unless we could get people tests and test, isolate, and trace that strategy of boxing in the virus, it was just going to continue to run rampant. And so that was really our strategy.
Anyone else? I don't know who's alphabetically after you, but anyone else wants to go next?
I think Elizabeth should go next, actually.
Muted.
Pardon. Okay, so just to add another layer to kind of everyone, because we all came in with slightly different experiences and different perspectives. So I had kind of gotten connected. I was a resident at the medical center at the time, but also knew some of the folks in this call because I'd been a student there as well. And so I got connected with the students who were engaging in a variety of different ways with their newfound time. And they were a huge catalyst, a huge source of energy and enthusiasm. They were in this amazing resource because the system itself was like just, trying to keep up. But we had all of these people who really wanted to figure out how to problem solve. And so, they were kind of constantly, we turned from being within the system to looking outside the system. And they were just asking the question, we were all asking the question, how can we mitigate the harm that we know is coming? Like it's happening and it's going to get worse. It's like watching the tsunami come. As a physician that was inside the hospital, I was actually in the intensive care units for quite some time. And the racial disparity that I think, Lori Lightfoot spoke about, it was national news, but it was so incredibly evident. I mean, for anyone who works in medicine or health, racial disparities are evident every single day. But the craziness of this pandemic was that we were taking care of people who are very, very, very sick in the hospital, who are from African-American and Latinx communities. And we know the way to stop the spread of the disease is, as Dr. Blair said, box it in, to test, trace, and then support people with isolation. But nobody was doing that. Mm-hmm. And so it was this utter sense of just desperation, frustration, and then fortunately we had this enormous source of fuel and energy, which were the students who worked with us. And I think in those early days, we all had a decent amount of fuel ourselves. And so, and there was a tremendous sense, not just from the students and from our side, but as we've alluded to, from the community side. And people know they're living lives, seeing their neighbors and their friends and their family affected. reading the news, wanting to do something to, address this issue. And so we were fortunate enough to make a lot of connections, and form a lot of relationships. And that's why CERCL stands for, oh my gosh, I'm blanking.
Yeah, I'm bringing it up now.
First word is collaborative. No.
Equity response. COVID equity response.
Collaborative. And so like we're just a few of the people who have been involved, but really the second C is for collaborative, and that's because that's really what has allowed, any of this to happen, is that community aspect, that collaborative aspect, that everybody has really just come together to make something happen out of just chaos, honestly. And so from that point, we were fortunate to connect with Ms. Gwen Haney. And so I'll pass the mic over to her.
Hello, I'm Gwen Haney. I'm not a resident of Maywood currently, but I've been a resident of Maywood since 1966. I first came to Maywood, graduated from the great Proviso East High School at that time. And I am a member of Rock of Ages Church. When I came on board, I knew nothing about what was going on. I came on board because our head of ministry, Reverend Lowe, came to me and said, these people from Loyola want to utilize our parking lot. Can you oversee it? And that's how I came in. And when I came in, all of these ladies, but have you guys noticed we're all ladies? Yeah. We're all women.
Right.
And they started to just pull me in, tell me about what they were doing and all of that. And also, I was able to supply them with a lot of information about the community itself, old and as much of new that I could, and how the people in the neighborhood was reacting to what was going on in the neighborhoods and what was going on in Loyola, because most of the people that's in Maywood itself and Melrose Park, I've also been a resident of Melrose Park as well, so, and the surrounding suburbs. So they wanted to know what was going on. What were these people saying? How can we reach out to them? And that's what I was pulled in to do. So I'm your community liaison, and I'm connecting them with the people that's out here as best as we possibly can.
Totally integral part of this organization. Totally integral.
Thank you.
I could say something else besides just telling us about the pulse. She's a logistics guru. She constantly tells us how to make it better, more efficient, that makes sense. She's one of the best things that happened to CERCL, I have to say. So thank you, Ms. Gwen. So I'll go ahead and take the baton. So when we did receive that seed funding, that intramural funding from Loyola, it was also I'll tell you who I am actually. I'm Abigail Silva. I'm an assistant professor in public health sciences at Loyola, and I'm thrilled to be a part of CERCL. But I was brought in because as they were talking about that boxed-in strategy, we were wondering, how do we do contact tracing? And I do have in my past work history, having worked with the health department. So I had some, ideas about that, or some background of information. And I knew that we couldn't just sort of do it on our own. It involved collaboration with the health departments at that time. So what I was able to do is, along with some CERCL members and students, is develop a freely available on-demand contact tracing program. Because all those contact tracing positions were going to be open because the health departments needed that kind of support. So that was my entrance into CERCL. And I have to say, even though we're sort of representing CERCL, there are so many more other heads, like Kate Mitchell from the Health Justice Project, and Maya Watson, who sort of co-lead that. So part of what CERCL does at our testing sites is, so Health Justice Project is a medical legal partnership. So when folks walk into our testing sites, we screen them for social and legal needs. And if folks, want some referrals, for some of their concerns, the Health Justice Project provides some of those referrals. So we're really thankful for them. So they're part of that work, as well as all our students and volunteers are an amazing part of CERCL. If you walk to any of our testing sites at any given time, I would say at least half are volunteers. They're walking, are walking around, and they're amazing volunteers. When we were doing community testing in this late summer, an opportunity arose. The Walter Foundation was looking to develop the Chicago CAN initiative. And what does that mean? It means that they really were looking for institutions who could do some research that would allow us to learn as much as we can about the current coronavirus. It was a novel coronavirus. It's a pandemic, and we needed to get more information as possible during this time. And so we were in a good position because we were already in the community, we're doing testing, and it was an opportunity for us to bring more testing to the community and service to the community, and to also bring the opportunity for research participation. Because as we know, many times our communities are left out of those research opportunities. So those are opportunities. So we applied for funding, and we received that funding in September. And that was great because the intramural funding was very limited, right? It only allowed us to be at Rock of Ages and Casa Esperanza, once a week at each site for, only testing about 50 people, because that's all we could do, because as Amy Luke said, those tests are very expensive. But now we've got additional funding to do more tests at more sites, and we're currently expanding. So now we have that, and we could do more than that, 50 tests a day. Through the Walter Foundation, folks who come through our door, they don't have to participate in research. They come get their tests. We still do the same screening, but we also offer them an opportunity to be part of the research. So there are 3 ways to participate in the research. One is banking the nasopharyngeal swab, so that our researchers could sequence that and again know more about this virus, so we're better prepared for the next one. The second one is a questionnaire where we ask basically about factors they might be contributing to a higher risk of getting an infection. So then again, we know more and are better prepared with interventions, for the current and future pandemics. And then the third part is an antibody or serology study. So it includes a blood draw and allows you to know the antibodies if you have some level of immunity to the current coronavirus. Again, those are all approved by the Institutional Review Board, and they're optional, of course, as folks walk through the door.
Can people do one or the other, or all
they
of
could
them?
do none, or they could do all of them, or they could just do one or the other.
Okay.
Or they come through the door, they do one, and then they think about it, and and say, maybe I do want to do the antibody study. They could come back and do that piece as well. Absolutely.
What's been the reception among residents when it comes to participating in the research? And then, how many people have you all been able to get tested?
Since the summer, we've tested over 500 folks.
Oh, no. We've tested almost 1,000.
Yeah, we're close to 1,000.
Tested
Oh,
1,000.
I might have a
well over
outdated data set.
500.
You were lowballing it. We tested 1,000 individuals.
I agree. We're close to 1,000 now.
I might not have
if we're not over. Yeah.
There you go. So we've tested over 1,000. And to answer your question, thank you for that correction. To answer your question, we've been pleasantly surprised at the uptake, of participating in the research. We started the research component in November, and folks tend to be receptive, and we're very delighted in that. And we're very transparent about that. So yes, we're happy that we're able to bring this to the community.
So you all started in Maywood, then started doing it in Merrill's Park. Have you been able to do it in other locations beyond Maywood and Merrill's Park?
Yes, we're currently in Berwyn. So we're in Maywood on Wednesdays from 2 to 4. We're in Berwyn on Fridays from 2 to 4. And we're currently talking to partners to bring in some testing to the other communities.
Okay.
So it's a work in progress.
And these are completely free, the tests.
Yes, completely free.
What do people need to? What do you recommend people bring to the test once they come? And you guys, you do other things beyond, or you ladies do things just beyond testing. You also refer people to various resources and things like that. So, what should they have handy with them when they come to the testing sites? And then what can they expect to leave with once they're done?
Absolutely.
They can come with just themselves.
They really do.
Yeah.
Yes.
We don't need them to come with anything.
And with a mask.
And if they don't have a mask, we have a mask for them.
Correct.
And then what can they take away in terms of other things beyond
more.
just
So right now, well, I also wanted to report that upon registration, we basically let folks know about their test results in 3 to 5 days, closer to 3 most of the time. And then we always followed up with a phone call with the positives and refer them to resources as needed. What we are planning to do now is also provide some information on the vaccine. So we will be providing that on sites as well. We're also working on some care packages that have some, PPE and other kinds of information, again, related to the vaccine, safety issues, and places where they could register or call to get registered for the vaccine. So we'll be doing that pretty shortly, starting next week, actually.
Can y'all talk a bit about the vaccine? And because I've fielded some questions among residents who are unsure how to get registered, who don't trust the vaccines, neither of them, the Pfizer or the Moderna one, and a lot of people who may, be victim to some misinformation and disinformation surrounding the vaccine. So, kind of tell us what you all have heard as public health experts and medical experts, and maybe try to clear up some of the bad information that's out there.
I can take this. It's first of all difficult to talk about the vaccine because the rollout and the availability and being able to get it is not easy. So even for those people that are pretty sure they want to get it, it's still hard. For the 1B, that we're doing in Illinois, which is those over 65 and essential workers. So we do have some things posted, both websites and phones, because some of our most vulnerable people, especially elderly people, are not going to be registering on a website. They're going to need a phone number. So first of all, for those who are convinced they want it, which I have to say, a lot of people are really convinced that they want this vaccine and they're looking for this vaccine. Hopefully through our, testing group and some of these websites, we can link people. I do think it changes every day. Every single day this week, it was a little bit different. So I kind of think, that's the main message there, is to stay plugged in. And as far as myths, and for those who are hesitant, I think, first of all, everyone that is hesitant, I want to approach with empathy, saying that, I think it's understandable to be unsure about this. It certainly is very public. It's come out quickly. Some people will say that's the reason why they're hesitant, is it got rushed, through development. And then that's one of the things I talk about, is that, the technology for these vaccines, the Pfizer and the Moderna, has been decades in the works. So it was really kind of technology that was sitting there waiting to be utilized. And once they were able to design it, it was well tested in all the proper trials and had very low incidence of major effects. There are some normal vaccine reactions. And so anyone getting the vaccine should know that after the first and especially after the second, it may be normal to get fever, achy, a couple days of headache and achiness. And that's not you getting COVID, that's you having an immune response, which is what we hope people have, so that their antibodies can last. So that's something to be aware of.
With this respect to the people who may have an allergic reaction to the vaccine, it's like 1 in a million or something. I mean, it's pretty, the odds that you'll get one is pretty high. I mean, low.
Yeah, it's so actually the the rate of allergic reaction to the flu vaccine is 1 in a million, and COVID is looking like between 1 and 5, maybe 10. It's still extremely rare. We've heard about each one of them, I believe, nationally, and so that's about 11 of them of the 26 million doses. So I think if you have allergies, if you have a history of severe anaphylaxis or allergy, you do want to review that with your physician before getting it. It's always good to have that conversation.
And I heard somewhere that people who know that they may be susceptible to allergic reaction when they're taking the test, it's smart to kind of have your physician nearby or somebody who can. Usually there are medical experts nearby just in case with prophylactics and stuff to deal with your reaction, right?
There are, and you're monitored for 15 minutes, so you're not just getting it and sent on your way. Then there are trained professionals there to watch everyone who gets the vaccine. Yeah.
And is there a website? I think Abigail, you may have mentioned. I know. So the number that we have on the screen now.
Facebook.
Okay, and then I'm sorry. For the vaccine, if people are interested in registering for the vaccine, is there a website that they can go to? Oh, okay. So this is it here. So they would go to the Centers of Disease Control right here.
So right now there's a county, Cook County, Public Health Department.
Okay.
If that's the county you live in. There are also going to be retail pharmacies. So the thing to watch, I think, is how retail pharmacies roll out. So we're getting the vaccine supply. The national vaccine supply comes to the state of Illinois, and the state of Illinois is really using the public health departments. Health systems themselves are getting a small supply. Yeah.
What I found out this week, guys, I don't know if I mentioned it early, went to the VA. I took my brother to the VA. The VA has us signed up too. You can call the VA and so all veterans can go to the VA. I sent someone there today to get signed up for the vaccine, and they're rolling them out there. Well, I'm speaking of Hines, so I would assume it would be the same thing at Jesse Brown.
Yeah, it's very accessible over there for any veteran.
And I think I want to reiterate a point that Amy was saying, that it's very understandable for folks to be hesitant. There's a lot of maybes out there. But I think my experience, and of course the providers could talk a little bit more to it, but when you have questions and they get answered and you look more, you learn more about it, you feel more confident, in making a decision to getting your vaccine. And I think that's what, public health, is tasked with doing, as well as the medical field is tasked with doing, and providing some of that information and that clarity. And we hope that, CERCL is working towards, providing some of that information and being there for the community.
Have either of you been vaccinated? Okay, and have you received both shots, or just the one?
So, yeah.
Okay.
And I'll be getting mine soon.
And was it Pfizer or Moderna, or?
I think we all had Pfizer. Did we all have Pfizer?
Yeah. I had Moderna.
Okay, I had Pfizer.
I had Pfizer too.
Yeah, I had Moderna. And Ms. Gwen,
I'm on the list.
All right, you're on the list. Okay, that was my question.
What are the differences between the Pfizer and the Moderna vaccine? I know it's a matter of temperature. One is requires colder storage than the other, I think.
Yeah, a slight difference in the cold storage and a difference in the interval between the first and second shot, but the mechanism of action, how it works, is the same.
A lot of people, so students are coming back to school, and teachers especially are also heading back to the classroom for hybrid learning. A lot of teachers are afraid. I've encountered this just through my reporting, education reporting at various high school and elementary school districts. A lot of teachers feel that they should be vaccinated first before being required to return to the classroom. But there seems to be I guess there's the teachers who are afraid. There's that narrative, and then there's the narrative among public health experts who are putting together the guidances that administrators are following with respect to their hybrid plans. And they say that schools are not sites of significant community spread. What's the science behind it? Is that sort of established? You could comment where you feel comfortable with commenting, and if not, just you don't have to answer the question if you don't feel comfortable answering.
I can say that the science behind the kids, particularly young kids, of them getting infections and being spreaders, is showing that they are not the main culprits of spread. And they do not, mostly because they don't get the same sort of illness. They don't get a lot of virus that they're coughing and spewing out. So I think that is a key point of the research that the public health and the state guidance about safe return to school is working off of. Now we have a lot of studies, because a lot of schools did go back and they really watched those schools to say how many, in-school transmissions were there, and those rates are pretty low. So I think that the concerns that teachers who are adults have getting it from each other, is just like every workplace. It takes a while, and like Elizabeth and I have been in person workplaces in the healthcare, and it does take a while to kind of get used to always being in your mask and maintaining distance and putting in all those pieces that are important beyond the vaccine, because the vaccine alone is not going to get us out of this. It's going to be all those pieces that I think that the schools that put those all the pieces into place are going to successfully get everyone back safely.
Dr. Blair, I've got a lot of questions about, they want the children to go back to school, of course, but the question is not the child necessarily, but the child carrying the vaccine and carrying it home to the grandmother or someone older in the home, or they have some teenagers that's in and out, or younger people that's in and out, that's going to bring it there and then bringing it to school. That's a concern. So can you talk? That's definite concern in Black community. I've heard a lot of that.
What?
I mean,
oh, go ahead. I'm sorry.
No, I would just say, I think that the older kids, and what I mean is teenagers and then young adults, the young 20s, I think that that is completely different science. They do get and spread much more than the young kids. And so in households that have multiple generations in the same household, that is a concern. That's a concern about anyone who's out in the community. Yeah.
I hear that. And that's probably why you may see more Black and brown households and lower income households opting to stay home and just continue full remote for the rest of the school year, and others who are in a better position, taking their kids to school or allowing their kids to go back to the classrooms. It's probably something that schools might have to balance. And how do you, and try to consider equity when you're talking about these hybrid plans.
Definitely.
But that's a conversation for another day, perhaps. What does where does CERCL see itself going? As we get deeper into another phase of this pandemic, particularly as it relates to responses to these new mutations, these new strains of COVID-19 that's happening. Is that affecting what you all are doing on the ground? Are you more vigilant while you're out there getting people tested? And does it affect does it affect anything that you all do?
Well, I'll just add a little piece. We're very cognizant of the new variants, and we are obviously watching the science and the information coming out as to the efficacy or the effectiveness of the vaccines against these new variants, and as well as the spread. I mean, I think in the US, we're a little behind the curve because we're not monitoring the genotypes. We're not monitoring for the mutations that are occurring at nearly the same level as other countries. So we're not exactly sure what's going to happen around the bend. But I know that we all feel this way, that we want people to know that we're here for the long run. And as hopefully very soon, the COVID, very soon, it's all relative these days, but before too long, maybe we'll see an ability to sort of step back from the pandemic issues. But hopefully we've created such a nice and positive and strong infrastructure with our faculty, our students, our staff, our community members, that we want to continue this collaborative effort in addressing other issues that impact health equity.
Yeah.
And so we hope we're in this for the long term. We hope not with a pandemic. We want that to be over as soon as possible. But we're here in Maywood for the long term.
Where can people go to I know the Facebook, I'll put it up one more time. There's the Facebook page, but once again, kind of explain and let people know what the hours of the various sites are and the days of operation.
Sure, absolutely. Thank you, Mark, for giving us that opportunity. So we're in Maywood on Wednesdays from 2 to 4 p.m. And we're in the Maywood Park District Recreation Center. So you can find us there. On Fridays, we're in the Berwyn Public Health District, which is on 26th Street. And we're there on Fridays again from 2 to 4 p.m. And then I'll also provide you with the Facebook link that has that information.
All right. And the Facebook link is on the screen.
Thank you.
The hours in Maywood are on the screen. And then Berwyn, one more time, the days in Berwyn.
Sure. In Berwyn, we're in the Berwyn Public Health District building, and that's on Fridays from 2 to 4 p.m.
Okay.
Thank you.
So I really appreciate you all being here and doing what you've done. This is amazing, what a group of individuals, because that's basically what this is. This is not the institution per se of Loyola. It's just a lot of people within Loyola who decided that something needed to be done. And of course, the people were women who did it. That's usually how stuff gets done. Well, I appreciate this, and thank you for everything that you all are doing. We hope that by this time next year, we hopefully we won't have as much need for what you do.
Right. Hopefully we've moved on to other things.
Yeah, right. And you're right, other and better things. Hopefully not crises, but
right. Thank you, and thank you for the support, Michael. Very much.
Thank you so much,
Michael.
Thank you.
Thank you.
Thank you.
Thank you, Michael.
Thank you, Michael.
Thank you, Camille.
Take care.
Bye.
Bye-bye.
Bye.